Welcome back, everybody. May is Stroke Awareness Month, and did you know that there are warning signs? 4 of them, in fact, for signs of a stroke. What are they? You don't know? Don't worry, we've got you covered. Joining us now live via Google Plus is neurologist Heide, doctor as well. He's here to discuss strokes and some of the things you should watch out for, things you may not normally pay attention to. Dr. Heide, thanks so much for being with us. Talk to us a little bit about stroke awareness and some of the signs that go along with it. What exactly do we need to be looking out for?
Yeah, absolutely. Stroke is very prevalent. Over 700,000 people in America have a stroke every year. And we're talking about people who could actually prevent this stroke. You often have symptoms and signs of stroke before it actually occurs. So it's something that actually can be prevented. The signs and symptoms you're looking for can be anything. The typical ones that we go over are, do you have a facial droop? Do you have any trouble speaking? Do you have difficulties with, walking, or does your arm droop? And so typically we use is the mnemonic FAST. And so FAST is face, A is arm, S is speech, usually slurred, and T is time, which is actually very important. The faster you get it treated, the better. Time is brain, and the information we usually use is you lose 1.9 million brain cells every minute you are not treated successfully for a stroke. And so we're talking about when you have a stroke and you have a blocked artery, which is basically what you do. I think of stroke as mostly plumbing of the brain. And so if you have a blocked plumbing, you want to open that up. We use something called TPA, which is similar to Drano, to open that up, but you want to go very quickly. And so that's the point, is that you want to prevent it first, and if you can't prevent it and you have the symptoms I discussed, you want to get in very quickly.
So how do you know exactly if you're having a stroke?
And so, yeah, exactly, and that's the thing, is that people will have symptoms. I had symptoms one time during my clinic where I was able to speak and see, and that was actually turned out to be a migraine, but it could have been a stroke. And people often blow those symptoms off as something benign. But my feeling is, if it's something new and it's something focal and it's something you're used to experiencing, you need to go in.
What are some of the things you can do to reduce the risk of a stroke? There are things out there that you can kind of help yourself with.
Absolutely. The basics I use and teach my patients is that take care of yourself. You eat right. You exercise. You watch your blood pressure. You don't smoke. Things of that nature is probably the most important things you can actually do for yourself.
If someone would like some more information, how can they get a hold of you or get some more information about strokes and stroke awareness and some of the signs?
Absolutely. We have an excellent website being set up for our new program at stmarys.com.
All right, St. Mary's Reno, thank you so much. I appreciate it. A lot of great information. Be aware. Arm yourself with the good information, tips and otherwise. Thank you so much. I appreciate it. Dr. Heide, go down to Tim now with a quick look at our forecast. Hi, Tim.
Good morning to you. Our low pressure system from yesterday still pulling away from the area. Some showers for eastern Nevada right now, but we're looking mainly dry for western. The rest of your forecast coming up.